Hi class, and welcome to today's lecture where we'll be talking about tobacco use. This is going to be kind of the end unit or the end chapter of our unit on substance abuse and drug abuse and addiction. And I think it's really important to talk about because tobacco is something that a lot of us run into possibly on a daily basis, whether you smoke tobacco or utilize tobacco products, or whether you know someone or you run into someone that is smoking or utilizing tobacco products. So let's get started. So who uses tobacco? There's different individuals, gender, ages, ethnicity, education levels who utilize tobacco. And we understand that back in the day, in the 40s, 50s, 60s, no one knew of the harm of tobacco. And so smoking was kind of something that individuals did in order to relax, in order to think or be socially involved in whatever the situation is or the event is. Young people and alternative tobacco products, we understand that e-cigarettes are really becoming very, very popular, and mainly because it's new, it looks cool. The tobacco companies have done a really good job at ensuring that it's extremely attractive to young individuals and young eyes, especially young children, and how they package in bright colors, how they make it look very high technology. And so we know that this is something that we're going to see some health effects from later, but because it's so new, we still don't know the types of health effects or the full array of health effects. Just like with cigarettes. With cigarettes, we didn't know back in the day that it was as harmful as it is, but give it 20, 30 years, and then we really see these long-term effects and what is happening to individuals who utilize these products on a chronic basis. There's cigars, there's hookahs, and when I was in high school, hookah was really, really popular, but honestly, it's similar to e-cigarettes, it's just a different method, it's just a different format. Cigarette smoking has declined. There are individuals who are considered light users or occasional smokers, normally in just a social setting or after dinner or with drinks. Despite it being a crime to sell products to individuals under 21 years of age, there's an estimated 80 million packs of cigarettes used each year. And this is just a general overall statement. We don't know why these minors are purchasing these products. It could be for a grandparent, it could be for an aunt or uncle. So it doesn't mean that 80 million packs are being used just by minors. It's just saying that in terms of purchasing, this is what's going on. This is what's happening. So Centers for Disease Control, the CDC, has created a 2008 US map to show the users in different states. And as you can see in California, it's extremely light because of the type of culture and the type of health influence that Californians have, especially in Southern California. In Southern California, it's more of a marijuana use and more natural products versus back east, where you have a lot of the older individuals, the individuals that grew up in the 50s, 60s, 70s, and that's still kind of a way of life. And later we'll get into the addiction aspect of things, and not necessarily saying these individuals want to continue to smoke, but that addiction kind of holds them to continuing to use the product, and that's exactly what the tobacco companies want. So who uses tobacco? Gender and smoking. Women under 23 are becoming smokers at a faster rate than the rest of the population. Not exactly sure why. Also, other different types of populations or subcultures, lesbians, gays, bisexual adults, are found to smoke more than straight adults. And again, why this is, we don't know. This is just surveys that have gone around the country, and this is the type of data that we're finding. So there is research, there are surveys going out to figure out why this is the case, but as of right now, we don't exactly know why these populations utilize these types of products more so than other populations. Tobacco and other drugs. Smoking is high among alcoholics and heroin addicts, obviously because that tobacco creates a chemical reaction similar to heroin or drinking alcohol. Is kind of that feel-good reaction you get from what individuals told me is like a little buzz. So that's why those individuals, if they can't get their drug of choice, they will go and choose a different drug to kind of fill in the gap until they can get their drug of choice. Smoking is more prevalent among people with mental disorders than among the rest of the population. Again, not sure why. The idea is that perhaps this is a coping mechanism for them. It's a way for them to kind of calm down whatever the disorder is that they're dealing with temporarily until they can figure out some other way to calm it down. But remember, there is going to be a situation where they get pretty adjusted to the level that they're using it at. And at some point, you're going to have to increase to a different level, meaning you're going to have to smoke more, or you're going to have to switch to another substance in order to get those same effects. So estimated annual mortality among cigarette smokers, and this is strictly just with cigarettes. We will talk about some e-cigarettes later. But as you can see, when it comes to lung cancer, that's going to be the highest, right? Because obviously you're inhaling smoke. So now you're adjusting the physiology and the anatomy. And now we can start to get cells that start to act a little weird, right? Just like cancer cells act a little weird. So lungs generally are the first ones that are going to be affected. This is going to be a type of cancer that individuals are more likely to die from. There's a higher rate of mortality for this type of cancer, because individuals will wait. They'll wait too long, the cancer will metastasize, meaning it'll spread, and now it's throughout the body, and it's really hard for our current medical system to be able to control that without the cancer taking over the body. Heart disease, we'll talk about that. We have a whole chapter on heart disease, but there is plaque that is developed in the arteries of the heart, and we know that the arteries of the heart is the blood supply to the heart. And this is dangerous because if the heart isn't getting blood, that means it's not working, it's not pumping. That means you could have a higher risk of a heart attack if this happens. Chronic obstructive pulmonary disease, again, this is another lung disease. This is a disease that lasts for a while, and it severely decreases the oxygen concentration in the individual's body because they're not able to take in enough oxygen. Those alveoli, the little gas exchange chambers that are in the lungs, no longer work to their efficient manner. And so now we have decreased oxygen, therefore the person's entire way of life has to be changed. There are other diagnoses, there are other cancers that have been linked to it, but lung cancer, heart disease, and COPD is going to be the ones that are closely linked to that, All right, so who smokes cigarettes? A lot of individuals do. Again, remember that this is something that was commonplace back in the day. I mean, 50s and 60s, physicians were videotaped in commercials saying, whenever I need a break, I go outside and smoke, right? If you drive by a hospital, you'll see nurses, there's a lot of still healthcare individuals who continue to smoke, and not that they want to again, it's because of that addictive factor. They haven't figured out how to let go or how to disconnect from that addictive factor that a lot of these tobacco products have. All right, so we see in terms of race and ethnicity, this is always something that is interesting to most students. American Indians, those are going to be rated as the highest that utilize tobacco, but again, that's a cultural thing that they've done for decades and decades and decades. When it comes to white and black individuals, that's about even. Hispanics is a little less. Multiple race or mixed race, those tend to be a little higher. And again, a lot of this dates back to culture and what an individual's ancestors have done and what has been passed along in the family. So why people use tobacco? This is a picture of a tobacco leaf if no one's ever seen it. It's actually quite pretty considering the health effects or the negative health effects that it can have on individuals. These leaves are cultivated from the tobacco plant. It can be used as smoking, it can be used as chew, or it can be used as snuff. I know that chew is utilized a lot in the culture of baseball. Not so much softball that I've seen, but in my experience, baseball players have been the highest rate of users for chewing tobacco. And the addictive factor in tobacco is that nicotine. So nicotine is a psychoactive drug. Again, I've talked to individuals and they said that when you utilize a tobacco product, you get that initial kind of hit in your brain and you feel that tingle. And that's that nicotine that's acting on the brain receptors and kind of getting you that euphoric feeling. This, again, reaches the brain via the bloodstream. So I was asked recently, why is it that when I smoke, I feel it quicker versus when I eat something like an edible or something like that? Well, it all has to do with the bloodstream and how are you taking it in, what body process are you utilizing to take it in. That's going to hit the bloodstream faster. And the lungs by far is the fastest, minus venous injection, which is why a lot of heroin users inject because it hits the bloodstream like that, and that's how you're going to feel the effects faster versus having to wait a couple hours to feel those effects. Very, very powerful chemical messengers that get released, and this is gonna modulate your emotions. So a lot of individuals feel a feeling of euphoria when they utilize products like tobacco because, again, it hits the brain fast. It starts to change those chemical messengers, and you start to feel better, at least temporarily. All right. Again, there is going to be a tolerance that's built up. So for a while, smoking, let's say one cigarette, is going to be something that does it for you. But after a while, your body's going to get used to it and you're not getting that feeling anymore. So then you're going to have to increase your usage in order to be able to get that feeling again. And the more you increase that usage, the more of the withdrawals that you're going to feel. All right, we'll talk about that in a little bit. So the difference between heated tobacco and e-cigarettes, I felt like it was important to put something like this in here because, again, e-cigarettes is becoming extremely popular amongst the youth, and we really need to see the differences between those. So when it comes to an individual who is using tobacco products and maybe they want to get off of tobacco products, e-cigarettes have been found to be helpful. There's a big study being done in the UK right now that's looking at how are we able to effectively help individuals quit and get healthier while they're trying to quit, while they're trying to let go of that addiction. And e-cigarettes have been found to be useful, and that was the original intent of e-cigarettes, was to help individuals have if you're going to smoke, let's have a healthier alternative versus tobacco. But now that it's been out for a while, now we're seeing that maybe this type of product isn't actually healthier. It's just another form to get addicted to and to have some negative side effects from. In terms of new smokers, this was never invented for individuals that don't smoke at all. So we have a unit or cigarette that heats the tobacco, right? In the e-cigarette, it's vaporized e-liquid, and that e-liquid is really the danger of those e-cigarettes. It's not so much the device itself, it's the chemicals that are being put into these liquids, and it's the flavoring that's being put into these liquids. So while on the tobacco side, there's natural nicotine, there's natural tobacco, there is ash and smoke from that. When it comes to the e-cigarettes, yeah, there's no ash and smoke, but there's nicotine that is put into the e-liquid with all the other flavorants. And remember, these are being utilized by the tobacco companies. So if the tobacco companies are trying to get individuals hooked via cigarettes and now they own e-cigarettes, why would they not be doing the same thing except putting it in colorful packaging? So again, why people use tobacco, social and psychological factors that are combined with that. Again, for the individuals that have a history in their ancestry of utilizing tobacco products, it's more of a social aspect, possibly a ritual aspect, you can argue. Other individuals, it's a psychological factor that comes from that, whether they grew up in a household where they had their parents that smoked and they saw that all the time, their aunts and uncles, their grandparents. It really depends on the culture that you were raised in. Many people establish habits or cues that trigger smoking. So there are primary, there are primary reinforcers, and then there's secondary reinforcers. So primary reinforcement is going to be the reason why you do it. So a lot of times it's going to be the feeling of the tobacco, or it's going to be the feeling of euphoria, relaxation. The secondary reinforcers, not necessarily pleasurable themselves, but are associated with other stimuli, so different types of triggers that you can have. A stressful situation. I know individuals who, as soon as a stressful situation happens, I need to go outside and smoke, right? Because that's their way of coping with it. Is it a healthy way? No, but it's their way of coping with it. If someone's sipping coffee, there's a lot of individuals that will smoke while sipping coffee, and it's kind of like that thing that goes together for them. Going to a party, or even smelling smoke. Some individuals will smell smoke, and then that's that reinforcer that triggers it. The smell of smoke really isn't pleasant, but it's something that triggers them to go and recreate that habit. There are also different cues, and it's very important to understand cues in addiction because science has shown that those really go together a lot. So when it comes to cues, location can be one. So let's say you go visit your friend at his house, and every time you visited him in the past year, you guys have smoked. Right? That's going to be a cue for your brain because the brain knows habits. So if you continue this habit and you reinforce, the addiction's going to get stronger because your brain's saying, okay, well, whenever you go to his house, we always do this. So now I'm going to send signals saying, hey, you need to go do this. You need to go smoke. time of day, some individuals will come home immediately after work and go smoke, and after a while that becomes a habit. So as soon as you pull up into that driveway, as soon as you get home, your brain triggers, hey, we need to go continue this habit because this is what you've created. The people around you, your emotional state, immediate preceding action like work or dinner. So if you know an individual after they eat dinner, they go outside and smoke, that's a habit that they've created. So there's a couple studies that I left there for you. If you go onto the actual Canva website, you'll be able to get these PowerPoints without video, so you can click on these different links and kind of explore and kind of see what's going on with those different studies. But it's really important to understand that as we create a habit, we have control over that, but we also have control on not continuing that habit. We have control on changing that habit to something that's a little healthier. All right, there are genetic factors that play a role. So CYP2A6 is an enzyme that influences the way that nicotine is metabolized. So individuals that have this kind of genetic enzyme, the nicotine is going to remain in the system longer. Therefore, they're going to feel those effects a little longer. And everyone's different. And the only way to actually get tested, for example, like DRD2, which is associated with brain chemical dopamine. And if you don't know what dopamine is going to be a substance that makes you feel really good, right? A lot of individuals like that dopamine fix. I mean, some individuals can get that dopamine release by shopping or eating chocolate cake or getting in bed after a really long day, right? There's different things that can stimulate that dopamine release, and smoking and tobacco use is one of those. So again, I left a study for you if you'd like to check that out a little further. All right, so why start in the first place? In the US, nearly 90% of adult smokers report that they started before the age of 18. Again, remember the time is shifting. So us millennials, we're kind of in that generation where maybe some of our parents smoked and then quit. Maybe some of our parents didn't smoke at all. Maybe some of our parents did smoke. So a lot of us are kind of in that in-between stage where we don't know if people are going to develop that habit. And again, it depends on where you live. So in Southern California, smoking cigarettes, a lot of individuals look at as disgusting. But individuals that smoke marijuana, they don't look at that as disgusting because it's more natural. So again, it depends on where you're at, it depends on your culture. Characteristics related to tobacco use, again, parent or sibling utilizing tobacco, growing up and seeing that use and having in your mindset that it's okay, that it's not bad for you. Peers who utilize tobacco, and peer pressure. Now, peer pressure is more so with e-cigarettes versus tobacco because, again, we don't know the long-term health consequences of e-cigarettes. They haven't been out long enough. We do know the short-term effects within the first couple years. Individuals are starting to develop polyps on their lungs, and we have had reported cases of individuals dying due to e-cigarette use. Child comes from a blue-collar family. So blue-collar families historically have been known to smoke because they have financial issues, they have stress issues, and what's one way that I can make myself feel good even with all this stress and all this negativity that's going on in my life? Children that come from low-income homes, family is headed by a single parent. I come from a single parent household, and my mother did smoke for a while until she saw how it was really affecting my respiratory system. I wasn't able to breathe. I had asthma. I had mucus buildup all the time. And so from that point, she just one day decided to quit. And I'm thankful for that because my environment, my brother's environment got so much better after she made that decision. If a child drops out of school, again, the reason for dropping out of school is different. So some individuals, their reason for dropping out of school is that they need to go get a job, they need to help out their family. So those generally may not be the ones that pick up the habit of smoking, but those that are around the wrong individuals, just bad influences, those may be the ones that start to pick that up if they do choose to drop out of school. Child has positive attitude about tobacco. So you have a grandparent that utilizes it. Maybe he or she smokes it from a pipe. You have a whole family history of smoking. And so this is something that just, you pick it up and you don't think there's anything wrong with it. There's actually a positive attitude towards it. All right, tobacco users often rationalize the dangers, and this goes with a lot of substance use and abuse. So you don't want to make yourself feel bad for using it, but you know that you really want to because you get that chemical fix, you get that dopamine release. And so you try to convince yourself as to why you should smoke, right? It relaxes me. I deserve to do something for myself. When in actuality, in the back of your mind, you know you're doing your body harm, but you don't want to listen to that voice, at least right now. Later on, as you get older, some individuals want to listen to that, but for other individuals who rationalize, they really try to convince themselves that what I'm doing is not bad for my body. Media portrays smoking on young people as a positive thing. And again, this was more so back in the day. Nowadays, we really don't see commercials where individuals are smoking. If anything, it's going to be marijuana. But when it comes to cigarettes back in the day, this was shown as cool. This was shown as sexy. This was shown as, if you want to be this type of image person that we're showing you in Hollywood, then you should go smoke. And that's why a lot of individuals and a lot of moviegoers started smoking, because they saw their favorite actors and actresses utilizing tobacco products, and they said, well, if they're doing it, why can't I do it? So I included some perspective videos for you guys. There's one which is on the left of why individuals started smoking in the first place. And then the one on the right is actually pretty interesting because this is a social experiment. So it's an individual, a young kid that's going around and asking individuals for a cigarette for him to try for the first time. And it's really interesting to see kind of the dynamic between, especially the different age groups, on how they respond to him in terms of being the one that gets him onto this lifestyle and habit of smoking. So I'm going to pause it right here so you guys can go check those out, and I'll see you when you get back. So health hazards of tobacco use. Tobacco smoke, it's a very toxic mix, and there's a lot of different chemicals that are being heated to extremely high levels of heat. And when those chemicals react together, that's where we start to get a lot of these negative effects, such as cigarette tar. And this is going to be a brown sticky mass that's produced due to the particles interacting as you're burning the tobacco and as you're smoking that cigarette with all those chemicals in it. So cigarettes contain hundreds of damaging chemicals. A lot of them have been listed as carcinogenic, meaning cancer causing, and it pollutes the air all around us. So just like cars, just like factories, cigarette smoke can actually pollute the air, and it travels through vents. And I don't think individuals really realize this, is just because you went outside and smoked and came in, it's on your clothes and you go in your room, doesn't mean that if the air conditioner's on or you have the heat on, that it's not going to travel through the vents, and those particles aren't going to get to the nursery that's next door, or your next door neighbor, or your brother, sister, mom, dad that's in the house. Those particles travel. So the different chemicals that are in smoke, again, I added in e-liquid because, again, that's an extremely important factor. There is, of course, in tobacco products, rat poison, ammonia, butane, formaldehyde, which they use to preserve dead bodies, hydrogen cyanide, there's DDT, which again is a type of rat poison, radioactive gases, there's industrial solvents, there's swamp gas, there's copper, there's metals, there's gas and car exhaust, there's a lot of different products that are, or different chemicals that are in here that are in other types of things, like acetone, which is in paint strippers. So we understand that when we're utilizing tobacco products, we're inhaling and we're exposing individuals in our environment to all these different chemicals, and we already have pollution that we're having a hard time to control. We already have other toxic agents in our environment that's hard for us to control. So why are we going to add something extra onto our system to have to fight and deal with when this is a choice? We don't need to do that. On the opposite side, e-liquids seems a little less extensive in terms of the different types of components, and part of that is because a lot of the ingredients are not being told to consumers as to what's actually in it. This is, for the most part, what's been told to consumers of what's in it. Flavoring, nicotine, even if it says no nicotine, the FDA has allowed the tobacco companies to put on a label that there's no nicotine as long as the nicotine is under a certain level. So if it's under 0.5, I can't remember the measurement of unit, they can technically say that there's no nicotine in it, even though there is nicotine. And we know just with science and studies that even a little bit of nicotine can become addicting. And we're seeing a lot of reports from young individuals that are saying, yeah, I feel like I'm addicted to this. And I mean, some may say they're addicted to hot Cheetos, but when it comes to flavoring, there's a lot of weird chemicals in it, but none have been found to be addicting. We do know that nicotine, though, has been found to be addictive. And when it comes to the e-liquids, the flavoring is really going to be that aspect that is dangerous along with that nicotine, because The flavoring has a lot of chemicals. We don't know how those chemicals are reacting with the body. We do now in terms of inhaling this type of product, that the lungs obviously don't like it because there's polyps being developed and there's respiratory issues being developed. And yeah, it takes some time and it takes some chronic smoking of it. But as time goes on, these chemicals are going to end up damaging your respiratory system. So tobacco smoke, again, a toxic mix. There's 69 chemicals in tobacco smoke that have been linked to cancer. Some are carcinogens, again, directly causing cancer. Some are co-carcinogens that state along with other chemicals can cause cancer. So either way, you're inhaling something that can cause cancer. Tobacco also contains acutely poisonous substances. Arsenic and hydrogen cyanide are poisons. So you're literally inhaling poisons. Again, nicotine extremely addictive, and carbon monoxide. You might as well stand behind a car while it's running and just inhale the fumes and gases, because that's essentially what you're doing when you're smoking or using tobacco products. All right, tobacco smoke, again, is a very toxic mix. Additives account for roughly 10% of that cigarette. So what the tobacco companies like to do is they like to make the product pleasant, right? So a lot of the times what's done is sugar is added to kind of mask the bitter taste and to enhance the addictive effects. We know that there have been studies that show that sugar can potentially be as addicting as cocaine. So the more addictive factors we add into this product, the more individuals are going to have the urge and have the habit to actually go and utilize them, right? Some additives are used to make side stream smoke less objectionable. So side stream smoke is going to be the inhaled smoke from the burning cigarette, so it's coming off the end. And they've tried to make it to where the individual's not kind of clouded in smoke. So again, that means adding more chemicals to make sure that doesn't happen. So now we're having an effect of not only the individual smoking, but now anyone that is around the individual smoking is starting to take in those negative and chemical products that could cause cancer. So inhaling tobacco smoke brings gases, tar, and nicotine into the lungs. Again, fastest delivery system besides the veins is going to be the lungs. Reduced harm cigarettes, there's no such thing as a safe cigarette. Honestly, just like some of these companies that are greenwashing their food products now, saying, oh, it's organic, it's natural. There's no such thing as that when it comes to cigarettes, and there's no such thing as that when it comes to processed foods. And we have a whole lecture on that, which I can't wait for. So you will get to that soon. Menthol cigarettes are going to be the most commonly smoked by African American smokers, and this is just simply because of the culture, right? It was cool to smoke these types of cigarettes, and so that's what the African American culture has grown up doing. Now, a lot of individuals are starting to decrease that. Again, marijuana is starting to really come in as the main substance being utilized by African American smokers, but either way, both have an anesthetic effect on the individual, which is a desirable effect by some individuals, especially those individuals that are having issues or rough times in their lives. They like to kind of numb their feelings a little bit. So when it comes to market share of cigarettes, so these are going to be the types of cigarettes that are sold on the market, and the individuals break it down by tar levels. So as of 2013, the higher the tar level, the more that those cigarette products were purchased. And so now we're seeing that there is an effect from that tar itself that are getting people to want to actually utilize these products. The immediate effects of smoking. So there's immediate effects of drugs, and then there's a long-term effect of drugs. Right now, the immediate effects of drugs that we see, as soon as you start to inhale that, some individuals will get dizzy. Some will say that they feel like they have to faint. Their pulse will increase. They'll get cold, clammy skin, nausea, vomiting, possible diarrhea. This is all sounding like a patient going into shock. If you've ever taken my first aid and CPR class, this is exactly a patient going into shock. Depending on the dosage, the nicotine can excite or tranquilize the nervous system. So some individuals utilize it to relax. Some individuals utilize it as a way to kind of wake themselves up, right? So the cerebral cortex is going to be that outer region of the brain that's really stimulated. And this is going to be associated with behavior and mental ability, right? So some individuals, after they smoke, they feel a lot better. They feel a little more positive. It stimulates a discharge of adrenaline. So those individuals that kind of feel a pick-me-up at lunch after they smoke, that's going to be from that adrenaline effect, that chemical reaction. There's a number of physiological effects on the body. When you smoke, decrease oxygen intake, your pulse is going to increase, your blood pressure is going to increase. So again, essentially when you smoke, your body's acting as if it's going into shock, and that's because this is a toxin that should not be in the body, and that's why the body's reacting this way, because it's trying to figure out how to expel this toxin. Long-term effects when it comes to tobacco use, we know there's a whole host of long-term effects. Cardiovascular disease is going to be that main one. It's due to the free radicals and oxidative stress. Anytime you take in toxins in the body, and as the body naturally processes, there's going to be byproducts called free radicals that can create oxidative stress. If it's not filtered out of the body, this is when it continues to circulate, and it can cause things like CHD or coronary heart disease. It can cause atherosclerosis, which is a accumulation of plaque on the arterial walls. And we know the arteries pass that blood, that oxygenated blood, through our body into different tissues. So if we have blockades, that means that there's tissues that are not going to be getting the oxygen and the nutrients that it needs. Angina pectoris, this is going to be chest pain, not necessarily due to a heart attack, but it's going to be due to a development of coronary heart disease, which could be atherosclerosis, which could be increased plaque, it could be due to increased blood pressure. So it really just depends on the individual, but the individual could start experiencing chronic chest pains. Myocardial infarction, that is a heart attack. Individual can experience stroke. There's aortic aneurysm, meaning the aorta, the main aorta has ruptured because of all that plaque buildup that's going on, and pulmonary heart disease. Of course, we know lung cancer, prostate cancer. There's all kinds of different negative long-term effects that come from smoking, and you really have to think, is it really worth that temporary fix to have all these long-term life-changing effects? All right, so I have another video for you. This one is really interesting because you get to kind of see the difference between healthy lungs and the lungs of a smoker, the lungs of someone with COPD. So just like the last one, I'm going to stop it here so you guys can go ahead and check that out, and I will see you when you get back. So for those that are a little more visual, I have a chart for you guys, or really a illustration showing the immediate effects on the left side and the long-term effects. Again, it affects everything from the brain all the way down into the reproductive system. And so those that are looking to bear healthy children later on in life, if you're a smoker, that is going to decrease your chances of being able to birth healthy life, or even have healthy life start to develop in your womb. And for guys, you also have to be careful because all of these chemicals can change your DNA, it can change your gene sequence. And so if you are able to provide healthy sperm to your partner, that sperm isn't going to be, let's say, as genetically positive as you want it to be. And when you're creating life, you want to pass on the strongest genes you possibly can to your children, to your offspring, because that's going to carry on your legacy. So guys, you have to be just as careful as females in this. And due to the extreme heavy metals that are in the e-liquids, e-cigarettes are no better than tobacco products. As soon as someone stops smoking, you can see immediate improvements. Just like when you start smoking, there's immediate effects. You can see immediate improvements, as well as improvements days, weeks, months, even years out. So if you are currently a smoker, or you know someone that is a smoker, it doesn't mean that life's over. They can change their body systems back to a healthier state, maybe not exactly where they were at, depending on how heavy of a user they are and how long they've been using, but they can change their bodies to a much healthier state. And the health benefits continue the longer you stop this habit, the longer you stop smoking. So the likelihood of lung disease severely drops, again, because you're not inhaling smoke. You're not inhaling something that's not supposed to be in the lungs. People of all ages enjoy improved health after quitting. So this isn't something that's only with adults or only with adolescents. We've seen across the board, population, age range, across the board, everyone experiences health benefits as soon as they stop smoking. So this one's really interesting. Case Western Reserve University did a twin study. So what they did was they went to a twin convention, and yes, those are out there. There's twin conventions, twin carnivals. It's a whole society of just the same looking people walking around. But they asked twins ones who didn't smoke and ones that did smoke if they could just simply take different profile photos. And so this is kind of what they found was between the twin on your right hand side, the smoker, and the twin on your left hand side, the non-smoker, the twin who smoked, you clearly see differences in their appearance. And they didn't test their blood, they didn't look at the lung capacity, they just simply looked at appearance. And as you can see, there's a clear difference between the twin that did smoke looks unhealthy, the twin that didn't smoke looks a lot healthier. So these are 4 twins that they utilize. Here's another set of 4 twins that you can really see the dramatic effects. And especially in this one, on the lower right-hand corner, you can see the effects of the smoker versus the non-smoker. So it's really interesting just to see the different changes that happen. The one that's on this lower left-hand side, those photos are flipped. So for that, the twin who smoked is on the left side, the twin that didn't smoke is on the right side, versus the rest of the photos, the twin that didn't smoke is on the left side, the twin that did smoke is on the right side. So hopefully I said that in a way you guys can understand, but you can look the study up too. Just type in twin smoking study and a whole bunch of images will pop up on Google Images. So increased life expectancy. Data shows that quitting smoking at younger ages substantially reduces the risk of death from smoke-related causes. So quitting ages 25 to 34 adds about 10 more years to your life, versus 45 to 54 adds about 6 more years to your life. So again, everyone's going to experience benefits. And if you can add to your life, to the longevity of your life by simply stopping a habit and switching to something healthier, I mean, why not go ahead and do that? So again, long-term effects of smoking. There's additional concerns in terms of ulcers. So that's going to be sore spots in the stomach where the acid's kind of starting to eat through the stomach lining. This becomes bad because it's extremely painful. You have to really watch what you eat. You can't eat spicy foods. And I know some of you like those spicy foods. Thinning of the brain cortex. So now we're having a change in behavior. We're having a change in brain function. Erectile dysfunction. So gentlemen, if you want to be able to continue to go for long periods of time, smoking is not the method to utilize. Reproductive health problems. Again, a lot for the woman. Dental disease. So teeth start to decay. I know you've seen those individuals with yellow teeth, decayed teeth. Diminished senses, your sinus passages start to get damaged, so you can't smell as well as you used to. There are other different types of injuries and cosmetic concerns, such as your nasal passages. There is skin or are skin issues that start to develop from that. Your eyes start to get yellow, your fingers start to turn yellow, wrinkles start to become more apparent and more frequent. There's an economic cost of this. So some of you financially healthy individuals, a pack a day, if you do that for a year, it's about $3,600 per year. And a Juul habit, about 4 pods in a week. And I've researched, and there are some students that are utilizing 5 to 8 pods per week. And if you're just at the 4 pods per week, that's about $1,000 a year that you're spending on something that you really honestly don't need. So when it comes to the cumulative effects, there's a reduced life expectancy, and we know that there is science coming out that's saying the first person that's going to live to be recorded 150 years old is living today, right? So if that's one of your goals, smoking is not the way to get there. You will go online and you'll find some older individuals who said, I smoked a pack a day and I'm 112. Absolutely, there are those outliers, but understand and keep in mind that there's 7 billion people in the world, and having 5 people who are able to do that does not mean everyone can do that. That just means that for whatever reason, their body persisted them to continue to go. Maybe it was a whole mental state thing, right? We know that there is power of the mind. So just because a handful of individuals could do it doesn't mean everybody's able to do that. That's really not how the science works. But admittedly, there are individuals who admit I'd smoke every single day and now I'm 103 years old, right? So it does happen. Gender differences in health hazards. So women are at a greater risk of smoking related blood clots, stroke, cancers. When it comes to women and estrogen, our bodies just work different from men, and men's bodies just work different from ours. So we can't say, well, my brother does it and he's fine, but when I do it, I'm getting all these effects. It's because your body's different. All right, we have to understand that there is a physiological difference between men and women, and that when it comes to disease, our bodies react in a very different way. Tobacco use is associated with sex-specific health problems. Again, women, if you want to be able to bear children, right, you want that uterus to be healthy. And if your body's spending all its time trying to heal other areas that you're damaging, that's the last thing it's going to worry about. And also for gentlemen, you want to be able to share that extremely healthy sperm, those healthy DNA and gene sequences, so your offspring can have the best chance of survival. All right, estimated percentage of high school students who currently use tobacco products nationally. Any type of tobacco product is going to be increased, and this is including chews. This is including, there's, of course, the e-cigarettes. There's gummies, apparently. There's a whole lot of products out there that I didn't know were actually out there and that individuals are utilizing. So as of 2011 to 2015, we see that there is a decrease when it comes to cigarettes, cigars, hookahs, smokeless tobacco, and pipe tobacco, but there's a huge increase when it comes to e-cigarettes. And again, that's all marketing, and the tobacco company is extremely smart when it comes to marketing because they understand what is going to get the attention of our young generation. So now we have product users for the next 60, 70, 80 years. Risks associated with other forms of tobacco use. So spit or smokeless tobacco, this is the chew. You can have snuff, you can have sinus, like however you get into this orifice, that's pretty much what they've created. First and foremost, decreased sense of smell, decreased sense of taste, increased risk of gingivitis. There's a whole microbiome that's happening in our mouths that these types of products throw it off. So we can start to get oral cancer, you can start to get esophageal cancer. That's why they recommend do not swallow this stuff because it can make you extremely sick immediately. There are also reports in spit and smokeless tobacco that there are small shards of materials and metals that are put in there that when you stick it under your lip, it causes cuts in the gum line, which makes that tobacco and that nicotine get to the bloodstream faster. So we know with sugar, when we just eat, there's a mechanism in the body that allows sugar to start to get absorbed in the cheeks. The same with nicotine. If we can cause some small cuts in the gums, it's easier for those chemicals to get into the bloodstream, and now it's hitting the brain a lot faster. All right, cigars and pipes, nicotine is absorbed again through the gums. So even though individuals are like, I'm not inhaling when I smoke a cigar, you're still getting the effects because it's still being absorbed in the gums. And inhalation increases risk because there's a lot more of the chemical that's in these big cigars and these big pipes versus cigarettes. Either way, all of them are not very healthy for you in long term. All right, other forms, there's clove cigarettes. I didn't even know about these until I researched for this. There's bitus or bitus, 4 times more nicotine and twice the amount of tar. So it's going to be that second picture that's under the blacks up there. Hookah, it's pipe used for smoking specially flavored tobaccos, and generally it's going to deliver about 10 times more carbon monoxide than other cigarette products. And if you think about the culture of hookah, individuals are inside. So even if you're not partaking in it, you're still in the environment and you're inhaling this carbon monoxide and these different chemicals that can negatively react in your system. And e-cigarettes, although advertised as a way of quitting smoking, there's actually no evidence that the FDA supports. So understand that the FDA is a part of the US system. In other countries, their studies are showing that this could help individuals quit smoking with counseling interventions as well. So not just solely by itself, but with counseling interventions to figure out why the smoking happened in the first place. This can help the individual stop smoking. All right, the effects of smoking on non-smokers. So just because you don't partake doesn't mean that being in an environment is any healthier for you. So the EPA, the Environmental Protection Agency, has designed environmental tobacco smoke, or ETS, as a Class A carcinogen. So if you're in a room and an individual is smoking, you might as well be smoking with them because all of the tar that you're inhaling and all of the chemicals that you're inhaling are carcinogens that can cause cancer in you as well. So the Surgeon General said there's no safe level of exposure. So just because you're outside doesn't mean that you're not still being exposed at a certain level to something like that. Or if you live in an apartment complex and your neighbor smokes, it's coming through the vents. Just because you smell a small hint of it doesn't mean that you're safe, right? Maybe it's a little better than being directly in the room with them, but still you're being exposed to that. And understand that your environment is one thing that you can control. So if that's something you don't want, speak up, speak your mind, and let them know that if you want to go do that, that's fine, but don't subject me to your bad habit just because it's something you want to do. All right, there is a thing called third-hand smoke, and you guys can read mainstream and side stream smoke. Again, we talked about it earlier. It's just going to be what's burning off the end of the tobacco product. Third-hand smoke is what lingers indoor on surfaces, curtains, furniture, clothes. If there's an individual that smokes in a car and you get into the car and you kind of smell that residual smoke, there are forms of carcinogens that can be inhaled, that can be absorbed. Your skin is our biggest organ. As of right now, science might be changing that to the lymphatic fluids, but as of right now, your skin is this biggest organ and it absorbs everything. And so as you're in contact with this clothes, with this furniture, your skin's starting to absorb some of these chemicals that are on it. And again, it's not a good environment to be in, especially if you're a non-smoker and you're trying to be healthy. Speak your mind and let them know, this is how I'm feeling. How can we work with this? You have your habit. I'm not telling you what to do, but again, don't subject me to your bad habit. All right. ETS effects, coughing, headaches, nasal discomfort. Again, when I was little, my mom never smoked in the house, but I started really getting respiratory issues from that. Eye irritation, breathlessness, allergies, and asthma can start to either get developed or can get aggravated. So if you're the type little brother or sister you notice never had breathing problems, all of a sudden has breathing problems, even if mom, dad, grandpa, aunt, uncle smoke outside, them coming in and actually having that third-hand smoke on them could be affecting, especially the little ones, and they're pretty vulnerable because their systems are still developing. There's about 7,300 deaths a year due to lung cancer, 34,000 deaths from heart disease in infants and children. There's an increased risk of SIDS, or sudden infant death syndrome. Again, that's going to be a condition where the physician doesn't know why the infant passed away, but we just know that the infant system failed and passed away. And third-hand smoke, second-hand smoke can be causes of that. Also, asthma is an ear infection. If you have little ones at home, you know that ear infections are pretty common, and lower test scores on reading and reasoning. So we really see that the entire body is being affected by this habit that isn't necessary. It's not something that we need to be able to live. All right, smoking in pregnancy. I'm just going to run through this slide because you guys pretty much already know this. You're smart individuals. Linked to miscarriages, ectopic pregnancies. So those are going to be pregnancies in the fallopian tube instead of the egg being embedded into the uterine lining where it's meant to grow. It's embedded in the fallopian tube or becomes fertilized in the fallopian tube, and that's where the egg starts to try to grow, and the fallopian tube is not created for that. Low birth weight. There's higher rates of colic, cleft lip, palates, impaired lung function. So we're seeing a lot of birth defects that are happening from mothers that smoke. Behavioral problems, impairment in growth, intellectual development. So e-cigarettes are not safe. Nicotine is what damages the baby's brains and lungs, and that can actually, the flavorants that are in the e-cigarettes, the liquid, that can cause harm because of the severe chemical mix and high metals. And that's one reason why they tell pregnant women don't eat a lot of fish, is because of the risk to exposure of high metals. And if there's high metals in these e-cigarettes, that's not going to be something that's beneficial for your child. Cost of tobacco, we already talked about that. There's $170 billion total a year that are spent by our citizens on these products. And so the tobacco company, they're making billions, and they really don't want you to stop or want anyone to stop because they're making a ton of money off this. And again, it's America, freedom of choice. If you want to smoke, that's your choice. But understand that there are people getting a lot of money to make a lot of people sick. Costs far exceed the tax revenues from the sales of tobacco companies. So the average tax on cigarettes in 2018 was $2.04 per pack. We do know that there are legislations in place to try to get people to quit that have actually worked a little bit in terms of increasing the cost of these tobacco products, but it is a process. And really the power is in education and understanding that there's things you can do that can help you cope, that can help you with stressful situations, but aren't going to cause negative health effects like tobacco products will. So what can be done? So there's action at the local level. So we're talking about local governments, right? So your mayors, your cities, there's even things that you can do. I know that there's colleges around that are starting to become non-smoking campuses, meaning you can't smoke anything anywhere on campus. There are apartment buildings that are starting to do that. So they're smoke-free apartments. As of in public, you're supposed to stand about 20 feet away from any store entrance when you smoke. Again, whether people do this or not, that's a different story, but you have a right. These are things that are laws that are in place to help protect the non-smoker. So speak up and let these individuals know in a respectful manner, hey, did you know that you're supposed to stand 20 feet away from the entrance? I've done it before and it's been really received because some people just don't know. They're not trying to hurt anyone. They just know that they have this habit and they don't know how to quit this habit, but they don't want to harm anyone else in the process. Again, state anti-tobacco laws, there's FDA regulation on tobacco. So again, it used to be 18 you can purchase this, and now you have to be 21 in order to purchase any tobacco product. That's hopes that the younger individuals won't have easy access to these tobacco products, so you can miss that point of developing a habit. But again, we know in your 20s, 30s, you can develop a habit at any point in your life. The international action, so the World Health Organization has put out safety measures and has put out information, educational resources to educate individuals on this stuff. Action in private sectors, individual action. So again, you as an individual, you do have a say in your environment. And again, in a respectful manner, just speak up. And if you feel uncomfortable, don't feel weird speaking up about what you want, because obviously this person smoking is clearly telling you what they want. So speak up about what you want and how you want your environment to be. All right. How a tobacco user can quit. So there's a variety of options. There's been a lot of things out there because, as we know, with statements, individuals have said that they really want to quit. They just feel like they can't. Some individuals are cold turkey. They can just make a decision one day and say, I want to quit, and that's it. And they're done with it. But other individuals really don't have that. So behavioral changes, you need a strategy for success. What oftentimes helps is figuring out why they started in the first place and working from there. All right, so some individuals were pressured into it. Some individuals had it as a model growing up in their life that everyone smokes. It's not too bad, right? There's telephone quick lines that you can call, 1-800-QUIT-NOW. Should be pretty easy to remember. Smoking cessation products. So anytime someone mentions cessation, that means stopping of. There's Chantix, Zyban, nicotine replacement products like patches, gums, lozenges, nasal sprays, inhalers. I have seen a natural kind of e-pen where you put essential oils in it instead of like the e-liquid. It's like lavender oil or it's orange oil. And I have a friend that actually utilized that, and he said that he felt some good benefits from it. Inhaling essential oils at that close range, I'm not sure of the effects on that. I haven't actually researched or found research on the effects of that. I know in the environment it can be helpful, but in terms of that concentration in the lungs, I'm not positive that that's going to be the healthiest. But if it comes to essential oils versus tobacco nicotine, the essential oils, if you had to choose one of the two, go ahead and utilize that. All right, benefits of quitting smoking. So again, I told you about immediate effects and long-term effects. When you quit, there's immediate benefits and long-term benefits. So immediately within the first 20 minutes of the last cigarette anyone smokes, blood pressure drops to normal, pulse rate drops to normal, temperature of hands and feet increase. You stop polluting the air around you. You stop affecting the individuals around you. So even within 20 minutes, there's a lot of health benefits that can happen. And essentially, your body drops out of a shock state back to a normal state. 8 hours, carbon monoxide levels in the blood actually starts to drop back to normal. Oxygen levels in the blood increase back to normal. So now instead of having more carbon monoxide, which is an extremely toxic substance, versus oxygen, now we're having a rebalancing of what it really should be. 24 hours, chance of heart attack decreases. 2 days, nerve endings, ability to smell and taste start to get enhanced again. 2 to 3 months, your circulation improves. Some individuals are able to walk easier, especially when it comes to hills and stairs, because their body is able to actually take in the amount of oxygen it needs to recruit those large muscle groups. Lung function increases up to 30%, which is huge. 1 to 9 months, coughing, sinus congestion, fatigue, shortness of breath, all of those start to decrease. 1 year, heart disease death rate becomes about half of that of a smoker, and that's just 1 year after smoking. No matter how long you've smoked, this is the really cool thing, no matter how long you've used these products, you're able to see these benefits immediately and up to 15 years. 5 years stroke risk drops to that of a non-smoker. 10 years lung cancer rate drops 50% of that of a continuing smoker. Incident of cancers, mouth, throat, larynx, esophagus, bladder, kidney, pancreas, all of those decrease, and you have a decreased risk of ulcers. And then up to 15 years, lung cancer risk is about 25%. So you've really just 75%, you've saved yourself from that risk of lung cancer. Risk of heart disease and death drops severely compared to those of non-smokers. So really you have a whole host of benefits when it comes to quitting smoking, versus if you continue to smoke, you have a whole host of negative effects that could happen. All right, so a review. We talked about the demographic patterns related to tobacco use. Across all ethnicities, there's tobacco use. Of course, there's more in some than others. We understand that in terms of population, that the younger individuals aren't so much utilizing the tobacco products, but they are starting to utilize the e-liquid products. Why people start to use tobacco? Either they grew up doing it, lower income class, blue collar, their family around them smoke their entire lives, so they think that this is something that's just normal, that's okay. The health hazards associated with tobacco use, there's a lot of them, including decreased reproductive efficiency, lung cancer, decreased sense of smell. You can start affecting the individuals around you, especially the little ones. They can start to develop asthma, can start to develop allergies. The effects on the non-smoker, again, just because they're not with you doesn't mean that they're not being exposed to those negative effects, especially for the type to smoke in a car. And understand that in the state of California, it is now illegal to smoke in the car with a minor in the car with you. Social and legislative actions, so 20 feet away from any opening to a public building. There are residences, there are schools, there are apartment complexes that are now non-smoking campuses or environments. Different strategies that can help individuals stop, utilizing different cessation products, getting therapy. There's also hypnosis that individuals have utilized. So there's a lot of different things that you can utilize to be able to stop this habit, but really it's understanding you have a habit, and then it's finding ways to change that habit. Because if you learned a habit, you can unlearn a habit. You can replace that bad habit with something that's a little healthier for you. So utilize the different resources that are out there. If you have any questions, please let me know. And thank you for watching this lecture.